He's on the top left of my screen, but I'm not sure if that's everyone else. But he's the guy that you don't know, that you don't see around the gym. You've probably all read the bio, so I won't go through it too much. But Andrew's obviously a podiatrist, extremely well experienced and credentialed, and just knows the body inside out, and particularly the feet, and how it sort of pertains to movement and running. So I'll let him sort of talk away. He's going to sort of present a few different things, and then we'll sort of open it up towards the end for any questions you've got, queries. If no one asks any questions, I've got something that I'll ask him. But yeah, please feel free to jump in with any questions that you've got. But otherwise, I will hand it over to Andrew and enjoy.
No worries. Thanks very much for the very kind intro, Andrew. I'll share my screen because I've got a little presentation. I think there is a few people that continue to pop in. So what I'll just keep an eye on that. But if anyone's waiting to come in or anything like that, then let me know and I can let them in. Anyway, I thought probably what's really relevant to a lot of us at the moment is that because obviously the current COVID situation, we've had a very interrupted training experience over the last few months. And whilst that's obviously frustrating, and obviously all of us would love to be back in the gym as soon as possible, one of the things that we're seeing in the clinic, and certainly this time, but also a lot last time, was when people had an extended time off, they were getting injured on the way back. We know that people tend to get injured doing exercise in the very first few weeks back. So generally the first 4 weeks are your most highest risk, whether it be if you're starting to do running, whether you're getting back into the gym. The reason being is that most of us just do too much. We do more than our body can currently handle. We don't allow enough recovery, and we don't allow enough time to gradually increase the intensity. So what's probably really relevant for you, if you were doing 50 kilos on the bench press, and then 6 months ago, 3 months ago, and then you've had 3 months of minimal exercise, you're not going to be able to just walk straight back into the gym and lift that 50 kilos again. It's going to be really, really important to just increase things gradually. We obviously, dealing with the foot as podiatrists, see a lot of people who run. See the foot's probably the most important part in a runner. It's the part that hits the ground. It's the part that bangs into the road. So one of the simplest ways that you can help mitigate your injury risk, or I guess have a better experience with your exercise, is through footwear. Footwear's the simplest, easiest thing, but it's often something that's not done particularly well. You just go and find a nice pair of shoes that look good, not really sure of what they are and what they're for. So I thought I'd just go through a short little presentation on footwear, how it is relevant to you. And then at the end, I've just got a couple of 3 simple little tests that you can do that are really good predictors that we use a lot in the clinic as predictors of running injury, or just injury in general. So that tests that really we as clinicians would do routinely for anyone that's coming in to sort of see, perhaps why the injury occurred, or what's going on with it. So I'm Andrew, and I'm from Melbourne Podiatry Clinic. We're in Essendon on Mount Alexander Road. If you don't know where we are, we're that crazy roundabout near Essendon train station. We're right on the corner there, on Fletcher Street. My background's running. I've done a number of marathons, and I've done a few triathlon, long distance triathlon Ironmans. We work from people of all levels, from elite runners down to people who are just starting out. And we ourselves love keeping active and helping people keep active and achieve their fitness goals is a big sort of focus for us. That's my email. If you've got any questions on anything, I can certainly make that available. So as I said, we're going to go through how to choose the right footwear for you. So just some quick little simple tips. What are the different types of running shoes? 3 simple tests that you can do to assess your injury risk from running, as I said, and I'll go through those a little bit. So when we're looking at how to choose the right footwear, these are some of the things that you should be thinking about when you're going into a running shoe store, whether it be your local Sims or whether it be your Rebel or your Athlete's Foot or your running company. These are some of the things that you should be thinking about when you're trying on a pair of shoes. So first and foremost is when you put a pair of shoes on, how do they feel? So I know that's been really challenging at the moment because most of us haven't been able to go into a store and we've been buying things online. Unfortunately, footwear is not one of the best things to be buying online, particularly for the first time. No problems if you've always had a particular shoe and it's been great. You can just obviously just reorder it online. But how do they feel when they put it on? How does the fit to your foot feel? All shoes are slightly different. How does the cushioning feel? Go for a bit of a walk, go for a bit of a jog if you can. Some shoe stores have a treadmill. How does it first feel? If a shoe doesn't feel great, I wouldn't go with it. So if the shoe's not comfortable from the start, try another one. Shape. The shape of the shoes are all different and they do vary. Obviously, we all know that you need to get the right length, the right size. But did you know that the shoes come in different depths and widths? So you may be just say, look, I'm a size 8, go in and get a size 8, but do your foot being maybe slightly wider or slightly narrow, you might be better off in a 2A, which is a really narrow width, or in a D width for women, or a B and a 2E width for men. So there's also shoes that are just the design of them is different. And sometimes if you've got quite a high arched foot, quite a foot that needs a fair bit of depth, there's some shoes that work better than others. And going and trying them on, going to a sort of a specialty shoe store, certainly that first instance makes a big difference. Cushioning. So what are you using the shoe for? You need something that's high mileage, or do you just need a lightweight tempo shoe? That's certainly something to consider. Some people like that kind of light, responsive, not too much cushioning. Some people really feel like they want something that's well cushioned. And you will find that depending on the sort of activity you're doing, which I'll touch on, that the types of shoes or the specifications and some of the things within the shoe do differ depending on the activity you're doing. 4 is support. So you may have often been into a shoe store and worked out that they've got shoes with different support. Some are what's called a stability shoe, some are what's called a neutral shoe. Is any additional support in the shoe required? Or is that additional support actually a problem? So there is some instances for people with, say, a high arched foot, perhaps having some extra support through the arch is actually counterintuitive. So that's, again, if you're not sure, we can certainly help, or you can go to somewhere like a Soul Motive or a running company that do specialize in this fit, and they are really, really good at helping you kind of navigate that. Because, as I said, shoes are a really, really simple way that can often, because they're the first thing obviously that hits the ground when you're doing an activity, a really, really simple way to help provide some cushioning, perhaps some stability. They can just help reduce the load. Weight. So how light are they? One of the things that's happened over the last few years is that shoes have become really, really light. And I think that's a really, really good thing. You don't want this heavy brick attached to your foot. You want it to be an extension of your leg. And having a nice lightweight trainer is, I think, one of the really good things that's happened over the last few years with shoes. So there's 5 simple things. I'll just go back. There's 5 simple things that you can think about next time you go, and it will hopefully help narrow it down. There's no way you can guarantee it. It is a little bit of trial and error. I won't deny that, but it can help narrow it down to sort of getting close to that shoe that's going to work best for you. And I would always recommend get fitted. It's been really tricky at the moment. We've been often saying, look, we need to get someone in a pair of shoes. So fingers crossed in the next week, I'd say hopefully by next weekend, you can go in and get shoes fitted. And I would suggest if you're having any problems, you're just not sure, go and get your shoes fitted. It's worth its weight. And there's some really good places that do great fitting services. So what are the different types of sports shoes? So I thought the main ones I'd focus on the ones that probably are relevant to you all. So obviously we've got running shoes. They're probably the ones you're most familiar with. We've got cross trainers or gym style shoes. We've got trail shoes. So trails obviously off-road. Sports specific shoes, so things like football boots, netball, basketball shoes. We've got minimalist shoes. So when you go into a running shoe store, these are probably the 5 categories. Probably a few slightly more niche ones, but these are the 5 most common ones. And it's probably useful to just know when you go in there, which shoes should I navigate towards depending on what you do? And that's the really important question. You've got 5 different types of shoes. You really need to make sure that you think, okay, what am I doing in the shoe? A running shoe isn't necessarily going to be a good gym shoe, and a gym shoe is not necessarily going to make a great running shoe. So I'm working a little bit out about what shoes are going to be most appropriate. So running shoes, obviously they're designed specifically for running. So they're designed for that heel-toe motion. So running in a straight line, basically. They're designed to be hard wearing. So they're designed to be well cushioned. So it means that they can handle the loads of running. They're basically, for a lot of runners, it's 3 to 4 times your body weight going through each foot on impact. So for a 50 kilo, really lightweight runner, that's nearly 200 kilos of load going through your foot. So your foot just goes to show how amazing it is at handling that load, but a shoe also obviously contributes a lot to that. So if we're running on road, particularly, or hard surfaces, having a well-cushioned midsole that's durable and a durable outsole, which is the sort of the tread underneath, is really, really important. It's not designed to control side-to-side movement. So the upper of a running shoe is generally quite lightweight. They sacrifice a lot of the weight in a running shoe by ditching it from the upper. So the upper really isn't designed to control this movement at all. It's designed to control, it's designed to basically be breathable. So the breathability of the shoe is super important for running, because obviously you're going to be sweating it, but it's not designed to hold your foot into the shoe as much. The thing with running shoes is there's heaps of them out there. So the good thing about running shoes is that there's heaps of styles, heaps of size options. So you're generally never going to have a problem with a running shoe finding a shoe that's going to have a width option, at least a couple of width options, good size range, and lots of different color choices and designs. So you go into a shoe store, they're going to make up the vast majority of a running shoe store. What are some of the key features of runner? They increase cushioning from heel to forefoot. This is compared to most other shoes, so a lot more cushioning. Greater torsional stability. So it means that the shoe itself has got a lot more torsional. Often there's a sort of a truss through the mid shank of the shoe. That is a little bit dependent on the brand. In fact, there's a trend to slowly shift that, but generally you'll find you won't be able to sort of twist a running shoe as much as some of the other shoes. Much more stable. So they're designed to have that stability, particularly in that heel-toe movement. Much better durability, so for running. So I will have that caveat, because if you go and play basketball in a running shoe, it's not going to have good durability. It's not designed for that, but it's got excellent durability for running. It does obviously depend on how much you pay and depending on the brand, but a running shoe should give you at least 600 kilometers per pair of shoes. So for a runner, if you're doing 20 Ks a week, you're going to go through that within a year. So I think often we sort of forget our shoes a little bit, and the shoe we might wear for, like, we might think they sort of last a couple of years, but for most people who are active, like all of you are, you're going to actually find a shoe probably needs to be replaced within a year. If you're doing more than that, I would be suggesting even sooner. So people who are doing reasonable amount of running are generally replacing their shoes every 6 months. Stack height. So the other thing with running shoes is that they do have a little bit of a heel pitch, and this is designed to help encourage that heel toe motion. It's designed to take a bit of load off the Achilles and the calf. So between 8 to 12 millimeters. And make note of that because there are differences in some of the next shoes I'll talk about. So the shoes you've probably heard about are things like the Asics Kayano, Brooks Adrenaline, or the Glycerin, or the Ghost. Zuno do a range of running shoes. Hocker's probably a recent one that's come on the market. There's lots of designs. There's lots of things that they're trying to do and professing to do. It's a case again of working out, okay, what's going on with the foot, or what injury or issues going on with the foot, and then matching the shoe to it. So cross trainers. So these are shoes that you'll generally see for gym, specific for CrossFit or gym-based activities. With a big rise in CrossFit and things, there's a whole range of shoes that have come out in recent years. For this, the key sort of feature with these is that they've got a lower center of gravity. The heel's lower. It's designed to have less cushioning, more proprioceptive feedback, more to encourage a bit more sort of normal function, because you're not dealing with those such large loads that you're dealing with, say, in running. They have less cushioning and therefore a little bit less durable. But for people who are doing, say, some lifting in the gym or gym-based exercises, it's not so much an issue. They're going to be doing it on gym mats generally, or certain those sorts of surfaces. It's not going to be the same repetition, the same load. So durability isn't generally an issue. It's just that if you run in these, it can be. They're much better at controlling side-to-side movement. So generally we notice that the upper has a lot more to it. It's designed for those side-to-side movements. So if you're doing dynamic-based exercises, which you will in the gym, they're better for that. They're going to provide better support. They're going to hold your foot onto it, whereas a running shoe is not going to provide quite as much side-to-side movement. They do have less size and width options available. It's sort of a standard width with these. So that's one thing to be mindful of when you're going into the gym. So key features, lower stack height. So from the heel to the forefoot, it's a lot less. So we're sort of often between 0 to say 4 millimeters. Much more responsive. They're designed for that sort of dynamic movement, as I said, not necessarily in that heel toe plane, more side to side stuff, which is obviously replicating what you're going to be doing. Firmer sole, less cushioning, but less sort of stack height generally in the shoe. As I said, yeah, have have little cushioning and offer little support. So if you for a foot that just doesn't have too many issues, generally going to be fine in this sort of shoe. For if you've got an issue, or we need to be putting an orthotic in this sort of shoe, often not always a good shoe for this. Here's an example of some shoes that you may have seen out there. One of the Nike Metcons are really common. Reebok does a sort of cross training or CrossFit specific shoe. But with these, they're not great for running. So one of the things that we sort of see a lot is that if you're in the gym and you're wearing one of these shoes, fine, no problems. But if you suddenly start doing a bit of running, whether it be just part of your gym training or in between sessions, you might toss in a bit of cross training running, sort of to top up your sessions. You're going to find if you're using this sort of shoe, it's often not a great option. So things like, even if you consider things like a sort of a Nike Free or these sort of styles were more of a leisure type sneaker, which I'd probably also toss in the sort of the gym type style shoe. Fine, often for a lot of sort of, you're doing your lunges and your squats and these sorts of things. But when you take them out onto the road and start running in them, they're not designed for the loads of running. So they're just going to wear way quicker than a running shoe will. They're just not going to offer the same stability and support. So that's probably certainly something that we see a bit of, is that if you find in the past you haven't done a lot of running, you've been wearing one of these shoes, it should be okay. But if for whatever reason you've decided, I'm really enjoying a bit of running, I want to take up a bit of running, we'd strongly recommend at that point go and thinking about getting a running shoe. It often does mean you need a couple of pairs of shoes, but I'd say if we're all active, like we are, we're going to use them, and they're going to be used enough that I think you can you can certainly get the benefits of it. I'll quickly go through some of the others, but the other ones are trail shoes. These are great if you're wanting to do a bit of off-road, gravel or trails. The main difference is they're really just a version of a running shoe. They encourage obviously heel toe motion just with some extra grip. They are designed to be a little bit better over sort of unstable surfaces and rocks. Give you a bit more feedback, which is obviously pretty important on an unstable surface. Often made with waterproof material like Gore-Tex. Great for when you're running on wet surfaces, not great if you're getting your foot submersed. They end up being like a bucket. So be aware of that. If you bear that in mind. If you're going sort of walking through wet grass, they're fantastic though. So that's an option. And it's really, you don't tend to compromise too much on a trail shoe from a running shoe. Generally, they are just repurposed running shoes with some extra lugs and grip. So they're a good alternative if you find yourself doing a more off-road rather than trail. So if you're running around Brimbank or some of these places, there are a good option. The other ones, obviously, you'll see are sport specific. Some of you may be doing some sport. So these obviously designed specifically for the requirements of the sport. They're either a court sole for netball, basketball, tennis. So they are different. They obviously, you've got things like cleats or blades, the football boot for football and soccer. Often the designs in these shoes, whether they be football boots or basketball or netball, the designs of them do vary for the different positions. So often in football boots, the ruckman's boots will be quite, the bigger ruckman will be a bit different from a wingman versus the netball. Your wing attack versus say your goal shooter, goalkeeper are often going to be quite different. So they're designed to be more sort of changing sort of for cutting type movements, whereas your bigger goalkeeper might be more sort of straight line stuff. Really important for fit with these. Fit's often one of the main problems we see with these types of shoes. You've obviously got much more dynamic heel toe running. You can control that, predict that a bit better with these, particularly like those dynamic court type sports. If your foot's moving around in the shoe, the fit's not great. Often you have come into some problems. So there's some simple things often we can do. Often people might get pressure in a certain area, so we can just literally just grind a cleat, for example, down a little bit to take pressure off that. So there's often little simple things we can do to sort of tinker and tailor shoes a bit to the individual. Minimalist shoes, there's a big push perhaps 10 years ago with minimalist shoes. It's kind of fallen a bit flat. There's a lot of sort of things that were attached to that, which perhaps weren't very well researched. They'd sort of almost be telling people that they'd cure cancer, these shoes, but they're designed to mimic being barefoot, provide great neurological feedback. They can modify your gait patterns because the sensation is going to be different. These can be great options for the gym. They were a kind of an option that was produced for the gym that then for some reason got picked up by the running community. And the problem with that is that it just didn't come with an instruction manual. So a lot of people were thinking, great, I'll wear these and I'll go for a run, and they would, and they'd get stress fractures or Achilles issues and stuff because they just, like we were talking about earlier, they just didn't transition to them properly. So there are some benefits. I think you can certainly use some less shoes, whether it be, you don't have to necessarily go to this extreme, but and there is some benefits for wearing like a sort of a tempo, faster, lighter weight running shoe. To try and change things like your foot strike. So get you running perhaps a bit more midfoot strike if you're having some issues. And we do that a lot in the clinic. We do running technique changes where we might get someone running and just change where their foot's landing, and often immediately they can reduce the load through the knee and be able to manage their knee pain without really having to do much else. They do require a long period of adjustment, as I said, and we do often see a high risk of injuries, stress fractures, calf and Achilles issues, just because of the significant load, but also the fact that it does modify your gait. So you end up landing much more on your forefoot. So that's a quick little summary on footwear. I thought I'd go through, these are the 3 simple tests that we use in the clinic. Generally, we use them pretty routinely, but they're ones you can do yourself. They're not fancy, they don't need any equipment. They're 3 simple tests that really are pretty good, reliable predictors of whether you're likely to have an issue. So if we're seeing you performing poorly on any of these, it's a bit of a red flag that we need to go and work on it. And most of the time, to work on it, it's just what you're currently doing, which is exercise. So doing the exercise, getting stronger, working on some range of motion, working on your balance, those sorts of things. Those things are really simple things, but when you magnify it out over running, make a really big difference. So first one is a single leg calf raise, which I'll go through. Really simple exercise. Needs to be done properly though. Number 2 is a knee to wall lunge test. So this is measuring your ankle range of motion. Again, that's probably number 1, I would say, in terms of the predictor of ankle injury. So if you've got you score really poorly on that one, we're pretty likely that you'll develop an issue down the track. Single leg squat is another one. So this is certainly something that we tend to see a lot of. So I'll quickly just press play. So this is a single leg calf raise. So what we're looking to measure is how many you can do, but we're looking to make sure that you're doing them properly. So this tempo, so about a sort of a 1 a second, up, down. We're not letting the heel drop, so it's a controlled movement. We're also making sure we push through the big toe the whole way through. So when we're doing it, it's super important that we don't roll off. And we're also making sure that when we're assessing this, we cut it off. So we stop once the heel doesn't get as high as it did from at the start. So we're looking for form through these. So once the form starts to fail, we tend to know that other muscles are starting to recruit. And if you've done this test before, if you start feeling it in your hamstring, or you start feeling yourself sort of hitching yourself up, your calf's tapped out. So this is really measuring your calf's durability. And I'll flick to the next page. This is a really interesting, this is how many you should be able to do. So obviously it does decline over as we get older, but most people will struggle to get this. Like for a 40-year-old doing nearly 30 of these well is tricky. So 28 for a male, 24 for a female. But this gives you a bit of an idea of where we should be at. And if you find, you go and test it tomorrow and you can do 5, I would be recommending you add this into your program. I'm not necessarily suggesting that if you can't do whatever numbers appropriate for you, that you're about to fall over and get injured tomorrow. But if you're way off, I would definitely be throwing this into your program, and you can just do it as a bit of a warm-up. You can do it while you're brushing your teeth. I recommend my patients when they're doing this stuff to just attach it to something that you do regularly, work on it. You'll be amazed how quickly it improves. Knee to wall test. So again, really, really simple test. Basically what we're measuring is how far can you maintain your foot away from the wall, so your big toe away from the wall, while keeping your heel down and then bringing your knee forward. So we've got this nice little postcard that we've got that we give our patients so they can go away and do it. But all you need to do is a tape measure or a ruler. Work out where, just do the test. So bringing your knee over your second toe, keeping the heel down. Yep. And then keep working back until you start feeling your heel lift off. Making sure that you keep your knee and foot straight. So if you start noticing your foot's rolling in, often you'll find you can give yourself a bit more. Keep that knee over your second toe, keeping that heel down and bringing it into the wall and just work out. So for this test, we're aiming at least 10 centimeters. Now, obviously, height has a bit to do with it. So for kids, we're generally looking at maybe a little bit less. But around 10 centimeters you should be aiming for. So if you're struggling to get to 10 centimeters and you might be at 5, there may be a reason for it. One of the reasons being that you can have a physical limitation there, so bony block, or often it's that you've got really tight the calves that you can go away and work on. So again, if you're not, I'll just let, if you're struggling with that, then you can definitely work on that by just doing some stretching. I'll just be suggesting more dynamic stretching, or doing the calf raises and dropping down below 90 degrees to actually get better range. It's a good way to combine the two. So make sure your knee over the second toe, heel remains on the ground. We're aiming for greater than 10 centimeters. Again, if you're around 10 centimeters, it's not something that I would worry too much about. So it's one of those things, if someone comes in and they're at 12 centimeters, you're like, great, don't have to worry about that. An interesting thing that we tend to see is that people who complain of calf tightness, and they say, whenever I run or whenever I do exercise, oh, my calves just kill me. Well, what we tend to do is we measure this. And a lot of the time, the knee to wall test is fine. So why are they feeling the calf tightness? It's because they're weak. What happens is they've got normal range, but when they run, their calf's weak, it goes into spasm to try and protect it. And your calves get really sore and tired after you run or you do certain exercises. So rather than it being, your flexibility is not great, like, oh, I've got really poor flexibility, it's actually, no, that's fine, that your calves are just weak. Go away, work on your calf strength. So it's a simple test to sort of work out where this issue is coming from. It's a really good predictor. It's probably the best predictor of any forefoot, heel, things like plantar fasciitis, calf and Achilles issues. So definitely worth doing that. A lot of sports do that routinely as part of their ongoing assessment. In fact, we interestingly had the Surfing Australia physio present to us a couple of weeks ago. And he says it's that important in surfing that if you're not over 14, you're not going to make it as a surfer. So they don't even, unless they can improve it, they don't even take them on. So that's how important this test is. Single leg squat. Now, I'd say a lot of you will do a variation of this. With this one, there's a few things here, and I'll press play. So single leg squats are reasonably obvious exercises. Can be quite challenging for a lot of you. It's not a straightforward type exercise. We're probably more looking at how you do it. Hopefully this loads. Basically, obviously, a single leg squat, you're on one leg and you're just bending down to, you don't have to go as low as you would a normal squat. I'll try that again. But we're looking at things like, it's disappointing. We're looking at things like your knee position. So when you're performing a single leg squat, we're looking at, can you maintain your hips level, or does your hip tend to drop on the opposite side? So the side often tends to drop down. Is your knee coming in? So your knee not able to maintain it over your toes? And are you getting any pain? So when we look at things, can you maintain your knees over your toes? For a lot of people, that's really challenging. Can your hips remain level? Again, often suggests some weakness through your glutes. Does your arch collapse in when you're doing it? And are you getting any pain? So if you can maintain your knees over your toes, your hips remain level, the arch isn't collapsing, and you're not experiencing any pain, we're happy. That's a neutral test. You pass the test. It's a really good predictor of things like knee pain, shin splints, and arch injuries. So really good one. You can just do it yourself in front of the mirror. Stand there, bend the other leg back, do the, just squat down maybe sort of 50% of what you'd normally do. You wouldn't go down to 90 degrees, but maybe sort of just above. Have a bit of a look at what your hip's doing. Are you able to stay level, or is one tending to drop on that opposite side? Is your knee remaining over your toes, or is it dropping in? What's your foot doing? Is it collapsing in? And are you getting any pain? Because if you are, I would certainly be looking at getting that looked at. This is one, obviously, if you're unable to do a lot of these well, it's going to flow on into your running. So when you are running, it's likely that this is happening. So pretty good predictor of what may happen when you do exercise. It's one of those ones too in the gym. with things like your squats and your lunges and things. When you start to get fatigued, you're going to revert to this, and the risk obviously of getting things like your knee pain is a lot higher. So 3 little tests that you can go away and do. I would suggest you do them at the moment. If you're getting back into more exercise, there are 3 little things that if you haven't been exercising a lot, they probably have decreased. Your calf strength's probably decreased, your ankles stiffened up, and your glute strength and things is not as good. You're in great hands with the team at Listen to Your Body. So, get them to have a bit of a look at you. They'll be well across sort of these things, and they can obviously, perhaps add these into your program, but are really good things that you can do yourself and monitor yourself. I would strongly recommend that. So if you have any doubt, we can help. As I said, we're just down the road on Mount Alexander Road. Give us a follow on Melbourne Podiatry on Instagram, because we do put out lots of just sort of information on simple little things like what we've gone through today. But if you do have any issues, you're not quite sure of, or you need some help, you're having any foot and ankle niggles, like anything, if you can get on top of it early, it makes a massive difference. And we can definitely provide some, hopefully, certainly in the early stages, some really simple solutions, and work with the trainers, because we do tend to sort of, a lot of the things that we're doing, we try to keep you in the gym, keep you running as much as possible. So a lot of it is really just exercise, rehab stuff. So that's it from me. I'm happy to throw it open, and if anyone's got any questions on any of that or anything foot related, I'm happy to answer a few questions.